Further debate. I recognize the member for Guelph.
Speaker, it's always a pleasure to rise in the House. Today, debate Bill 231, the government's health care bill. And I've got to put this bill in context, Speaker. Sadly, Ontario has the lowest per capita funding for health care of any province in the country. We're 15.2% below the national average. So what does that mean for people in their lives? Well, that's why we have 2.5 million Ontarians without access to a family doctor or primary health care provider, and the estimate is that that will more than double to over 5 million people. That's why 2,000 people are being cared for in a hallway right now in Ontario, which has doubled since this government was first elected. Job vacancies in the last decade have ballooned in our hospitals from 3,635 in 2015 to 23,330 today, and according to the FAO, that will rise to 80,000 by 2032. So that's why you have things like an unprecedented number of emergency department closures, over 1,000 this year alone, and the year's not even over yet. That's why you end up having things like the fewest per capita hospital beds of any jurisdiction in North America. That's why you have hospitals taking out lines of credit just to meet their payroll. And sadly, we saw 11,000 people die on a healthcare wait list last year. So that's the context in which this bill was introduced. And I know I've been listening to the debate intently. I heard the member from Eglinton Lawrence talk about the government hiring Dr. Jane Philpott to address primary health care. I have a ton of respect for Dr. Philpott, but I'm hoping that the government is not using that as a way to, overlook what's happening right now by deflecting some solution sometime in the future. Because we saw that with the government's Housing Affordability Task Force, where they failed to implement some of the major recommendations there, contributing to making the housing crisis even worse in Ontario. We saw it with the government ignoring the recommendations of their own Blue Ribbon panel for post-secondary education, which, by the way, is also last in Canada in per capita funding. So when I dig into this bill, I think about the context and the healthcare crisis we're facing. So I look at Schedule 3 of the bill, where the government is basically saying, we're going to have more transparency and reporting from these private for-profit nursing agencies. But then I look at what's happening in our hospitals. And what's happening is they're paying more for less when they hire private agency nurses. As a matter of fact, it's costing our healthcare system now over an extra $1 billion. If the government would just respect nurses, PSWs, and frontline healthcare workers by paying them living wages, by offering them fair benefits and better working conditions, rather than their unconstitutional Bill 124, which brought in wage restraint and led to so many people leaving our healthcare system. Why not pay less and get more by treating nurses with fair wages rather than forcing them into private, higher-cost nursing agencies? Because when I dig into Schedule 5, and I think, this is great. They're expanding the scope of practice slightly for nurse practitioners. And so I would ask the government, if that's a good idea, and I think it is a good idea, why don't you expand the scope of practice for nurse practitioners to a full scope of practice? Why not allow nurse practitioners to bill under OHIP? Why not fully utilize nurse practitioners in family health teams and team-based care so we can provide expanded and better primary care to people in the province? I look at Schedule 6 of the bill and I think, this is great. They're going to provide access to your health information. Well, why doesn't the government actually start implementing digital solutions in healthcare? They did allocate $106 million to that in 2023, And yet today, when I talk to doctors, one of the biggest things forcing them to leave the profession, retire early, and not go into family medicine is the administrative burden they're facing. So here we are, after the government brought in digital tools, only 12% of pharmacies are actually using the digital prescription service that's available. Even fewer are using the e-referral and test ordering system that's in place. So when I met with a couple family doctors just the other day and a nurse practitioner, they said one of the most important things that the government can do is actually require people to use the digital tools we've already paid for to help speed things up for patients and to take the administrative burden off of doctors. I experienced this myself just the other day where my prescription was faxed to a pharmacy. They never got the fax. You know, if it would have actually been delivered electronically, it would have been there. I would have got my prescription when I arrived, and it would have saved the entire healthcare system time and money, Speaker.
For questions? Questions?